Today's video presentation is about dentist cognizance of oral health care towards child with special healthcare needs. The title of our study is Assessment of Dentist Perception of Oral Health Care towards Child with Special Healthcare Needs, a cross-sectional study. Every child has a fundamental right to his or her total oral health care. It's a motto of every periodontist. Children are a bundle of joy, whether they are normal or are born with some kind of disability. As per census of 2011, in India, out of 121 crore population, about 2.68 crore people are disabled, which constitutes of 2.21% of the total population. The awareness of oral health as a part of general health has increased exponentially, but there are still many aspects that are untouched. Studies conducted around the world have established that there is an unmet need for dental care in child with special healthcare needs. When the PubMed search was carried out, we found that there were no studies in this regard. Hence, the aim of our study was to assess the dentist cognizance of the oral health care towards child with special healthcare needs. The objective of our study was to assess and to evaluate the knowledge of dentists towards special healthcare needs, to assess the barrier in dental practices for treatment of special child, to assess the gap between the knowledge and practices for treatment of special healthcare needs. Moving on to methodology, a cross-sectional questionnaire study was conducted, which ethical clearance was obtained from the Institutional Review Board. Sample size was calculated according to the previous studies and standard sample size calculating formula. The inclusion criteria consisted of practitioners, postgraduate students, and interns. BDS students who were still pursuing their degree were all excluded from the study. Questionnaires were obtained from different published articles and were modified and condensed to 13 items covering the important aspects required. The questionnaire consisted of 13 questions. This was a questionnaire. The questionnaire consisted of 4 domains: the demographic data, the confidence, the knowledge, and the barriers associated. It was judged in 5 points Likert scale. Written informed consent was obtained from all participants. Pilot study was conducted among 20 subjects and was subject to evaluation. Retest of the surveyed question was done, including 15 participants, and the question were re-administered after 2 weeks. The alpha coefficient value of 0.82 was calculated. Final study was carried out and the data was subjected to statistical analysis. Data was collected and entered in MS Excel sheet. The statistics was calculated using IBM SPSS software version 20.0 Chicago. The tests conducted were descriptive analysis, Tukey's multiple post-hoc test, one-way ANOVA, Carl Pearson's coefficient test. Moving on to the results of our study, there were no dropouts in our study. The mean age of participants were 26.09 years with a standard deviation of 5.27 years, and the mean experience was 3.21 years with a standard deviation of 4.44 years. When we asked on how many patients do you treat per month, 167 participants said that they treated 30 to 60 patients per month. However, when we asked how many children with special healthcare needs come to your clinic in a month, 61.6% participants said that they were 1 to 3 children. When we asked, is a child with special healthcare need treated at your dental clinic? 33.6% participants agreed to this question. When we asked, if you receive a child with special healthcare needs for oral healthcare, would you refer the patient to a periodontist? 44.4% participants agreed to this question as well. We asked participants if they felt knowledgeable and comfortable in managing child with special healthcare needs. 42.4% participants agreed to this question. We asked if their treatment modality followed the main cause. 43.6% participants agreed to this question as well. Next, we asked the participants if they would prefer to treat the child with special healthcare needs under non-pharmacological method or clinical setup. 39.6% participants agreed to this question. Next, we asked them if they would treat the child with special healthcare needs under pharmacological method or a hospital setup. 34.8% participants agreed to this question. We next asked them, have they ever received hands-on and lecture training in managing child with special healthcare needs in your dental college? 18% of the participants strongly disagreed to it. However, 31.6% participants agreed to this question. We asked them, do you believe that your undergraduate has prepared you well in managing child with special healthcare needs? 28.4% participants agreed to this question. When we asked, do you think your undergraduate curriculum should add more syllabus about managing child with special healthcare needs? 37.2% agreed to this question. Then we asked, do you desire additional training for managing child with special healthcare needs? 114 participants agreed to this question. The next was, what are the barriers you face while treating child with special healthcare needs? 55.2% participants said that the behavior of the child was a barrier in the treatment. A correlation among confidence, knowledge, and perception was done using Carl Pearson's coefficient method. The p-value of 0.0001 was found, which is said to be very highly significant. The level of confidence was 49.2%, the level of knowledge was 59.6%, and the level of perception was 80.4%. Now let us see the discussion. Various studies around the globe have shown that most of the directors of dental institute indicate that their resident or students require more training with special pediatric patients. Various barriers exist for treatment of child with special healthcare needs, which include the fear of the dentist, distance to the clinic, cost of the treatment, transportation difficulties, and unwillingness of the dentist to treat the patient. A positive response was seen among the participants when they were asked if they would prefer or refer a child with special healthcare needs to a periodontist. 76.04% of the participating dentists followed the treatment modality based on a chief complaint. This indicated that there has been a changing trend and the dentists are becoming more aware of the treatment modality for child with special healthcare needs. Practitioners had more perception, knowledge, and confidence than MDs, PGs, and interns towards child with special healthcare needs and their treatment. The experienced practitioners had been in comfort and an ease in dealing with child with special healthcare needs. According to our study, the behavior of the patient and the level of the training were barriers in our study, where behavior of the patient was the most significant barrier. Coming on to the limitations, the results cannot be generalized. A cross-sectional survey with a larger sample size involving larger geographical area is required. The questionnaire can be aimed for clinician, postgraduate students and interns individually. Moving on to the future perspective. We as a community should take a step forward and raise an issue and get it to the notice of DCI so that training programs, certificate courses, diploma degree, webinars and seminars can be organized in this regard. To conclude, I would like to say that the current study revealed low dentist perception towards oral health care of child with special healthcare needs, and that there is a dire demand for campaign to broaden horizon of knowledge for the dental professional towards child with special healthcare needs. At the end, I would like to quote a famous quote by Dr. Temple Grandin, who said that there needs to be a lot more emphasis on what a child could do instead of what he cannot do. I would like to acknowledge my teachers, my colleagues, and the participants of the study. These are my references. Thank you.